Supporting your child during a needle poke. There are many ways to support your child during a needle poke. A needle poke is when blood is taken from your vein, which is called a blood draw, or a vaccine is given, or when an IV is started. An IV is a small tube that is put into the vein to allow your medical team to give special fluids or medications. There are several different things that can be done that can help your child feel safe and secure and make the experience of the needle poke easier for everyone. Each child is different, so think about what has worked or has not worked in the past. It is helpful to make a poke plan with your child. A poke plan is a strategy to help your child ease their worry and increase their confidence when it is time for a needle poke. This video will help you and your child prepare for a needle poke. Encourage your child to drink lots of fluids the day before the poke. This helps make the veins easier to see and may make the poke easier. Staff may warm the area where the poke will happen with a wet towel or a warm pack. This also helps make the veins bigger or easier to see. You can speak with your child's doctor about applying a special numbing cream onto the skin before the appointment. This cream helps to make the poke less painful. On the day of the procedure, you can bring your child's favorite toy, stuffed animal, or blanket to have with them for comfort during the poke. If you want, on the day of the poke, staff can explain to your child what to expect during the needle poke. Explaining the steps of the process helps some children become more comfortable because they know what is going to happen with their body. Sometimes it is also possible for your child to safely play with medical toys so they can get more comfortable with the process. Ask staff if these supplies are available. During the poke, it is important for the room to be calm and quiet. It is best if there is only one person talking, so your child does not get overwhelmed. It is a good idea to decide ahead of time which caregiver or staff person is going to be the calming voice during the procedure. If your child is an infant, wrap them in a blanket and hold them on your lap. Try feeding the baby during the poke, breast or bottle feed. If your child has a pacifier, you can ask the nurse to dip the pacifier in sugar water. For older children, ask them if they would like to sit with someone or if they would like to sit alone. Sometimes a heavy blanket may be helpful for active or anxious children to help their body feel calm and still. Distracting your child during the poke is a good way to help calm their mind. Have your child decide what they would like to do during the poke. They could watch a video, read, or listen to music. Help your child with deep breathing exercises by telling them to smell the flowers and blow out the candles. Talk them through an imaginary experience. For example, you could say, pretend you are playing in the park with your friend, and then ask them questions about what they are doing there. For babies and young children, spinning lights or toys that make noise are useful as distractions. When you make the poke plan, ask your child what they think would be helpful. Give them choices, like asking them if they want to watch the poke or if they want you to count to 3 before the poke. Ask them what toy they want to bring with them or what video they want to watch. This allows them to feel like they have some control. Sometimes the thought of a needle poke can be stressful for children. Talk to the staff about the suggestions that have been shared in this video. Planning before the poke and creating a poke plan will make it a more positive experience for your child.